Just wanted to
Okay.
introduce, we've got Madam Mayor here for folks who have not met her, but we also have Dr. O'Neill, who's going to be speaking with us today about the importance of all of this. And just to give a little background on her, she's the Director of Clinical Effectiveness and a practicing therapist at Talkspace, so has the hands-on experience about that, community-based mental health and addiction treatment. So having your experiences is huge for this to kind of have the scientific and therapeutic angle to it. But Madam Mayor, take us away.
All right. Thank you so much. And great to see you, Dr. O'Neill. Nice to see you again.
You too, Madam
Anyway,
Mayor.
yes, it's great to see you. Okay. This is part of our Hopeful Cities initiative. I think many of you might be familiar with it. And if you aren't, this is sort of the component of the CARES Act funding that was really important to me and to the entire council. And that was really to look at the challenges of what we will face, during the pandemic and after the pandemic, of what I believe, we're calling COVID, this first wave, second wave, but I kind of have been calling it this tidal wave that we're going to see with some of the mental health issues and challenges as we move forward. I think that no one has been immune to some of the challenges that we've all been seeing. I mean, our small businesses, our artists, so many people across the board have been so affected, especially these small businesses that say to me, I have all this anxiety and depression that I never had before because my business is so uncertain. And then unfortunately, you have the tragedies of the deaths that we've seen. And that has just been so heartbreaking to see across the country, well, and across the world, quite honestly, because so many families are grieving. And COVID has been so brutal that when a family member goes into the hospital and they pass away without the love of their family members. We've seen people saying goodbye via Zooms and live feeds from their phone. And you have these doctors that have jumped in and sort of been that emotional support to a lot of these COVID patients. And speaking to a lot of physicians, they have said that it's added stress that much more onto their job as much as it's already stressful. But I think we're seeing so many intricacies of this pandemic. And for me, mental health has been extremely, extremely important. Physical health is important, but our mental health is just as important. So as a mayor, I really wanted to think outside of the box. And from my own experience of losing my brother and my sister this year, and going through a tough time with our community, there were times that, I had to admit, it's okay to not be okay. And sometimes we have to reach out for help. And in a pandemic, it's especially challenging because we want to stay safe, and going into a physical location certainly can cause other stress. And we wanted to keep people as safe as possible during this time. And so I did some research, and I started talking to people. Also, it was difficult for me to access going to see someone at the time. The wait times were incredibly long. But the other thing I learned is how challenging it is if you don't have health insurance or if you can't pay out of pocket. And especially when people are struggling so desperately and financially during this time, I just don't think people should be hindered by their ability to pay to seek critical services such as this and to take care of their mental well-being. So I got very passionate about it. I started to do some research. Catherine Getsky, so many of you probably know, who's helped launch our Hopeful Cities initiative, also has a major component, and that's the study of hope, because we know that hopelessness can lead to anxiety, depression, and suicide. So we really wanted to launch this initiative and make it free for everyone to be able to access. So if there's anyone out there, I would say please visit hopefulcities.org. It's a tremendous resource, and there are practices in there right from K through 6th grade on up. But one of the pieces that I wanted to bring in is Talkspace. And the reason is that you could easily pick up your phone and seek services right away. And my big goal was to make it free for every single resident in the city of Reno. So I am so grateful. When we got on the phone with Talkspace, I was so impressed because everyone that works there has a very personal story with mental health and why they work for Talkspace, why they believe in it so much. And when I used it, I was just so impressed that it could be something that I could access immediately without giving me the extra anxiety of having to go into a physical location when it's really hard for us to protect each other in these environments. I also want to add that we are working with many of our local therapists as well. So as we climb out of the pandemic, we will add another component on the local side so that people can be in person seeking therapy. We think that's important too. I'm always about working with our local community. But one thing governments don't do well is build infrastructures. And that would have taken us millions upon millions of dollars to build an infrastructure like this that Talkspace already has in place, that's very, very robust. And so I was grateful when the team from Talkspace jumped on a Zoom with me, and I was so impressed by their passion for mental health and wellness. It was just tremendous. So I'm grateful that we built this partnership together, and we are able to say that we are able to offer services to the entire city of Reno. I think we're the first city to step out there and think a little outside the box when it comes to how do we provide access to healthcare in our community. And I think this was a really good solution, and I've had great feedback. But we also wanted to make sure we did this presser so that we can make sure we can get this message out to people in the community that need it the most. And I'm going to send it over to the wonderful Dr. O'Neill because she's amazing, and she can walk you a little bit through more of what Talkspace does and how it works. So go ahead. The floor is yours, Dr.
Thank,
O'Neill.
thank you so much, Mayor Shivi. I mean, everything that Mayor Shivi just spoke to really underscores the visionary leadership that she demonstrated, that the City Council demonstrated when they embraced the idea of therapy for all. You know, it's part of Talkspace's mission, but the mission is only as good as the buy-in. It's only as good as the support that we can get from the community, from cities like the City of Reno, to truly make therapy accessible. And you know, the reality is we're all struggling right now. I don't think anyone would say that 2020 or 2021 has been the best year of their life. Everyone has experienced pain. Everyone has experienced loss of some sort, some folks more than others. The reality is that therapy, that services are accessible to anyone who needs them at this point throughout the city of Reno, whether it's a little bit of stress that you're experiencing, or perhaps more severe sort of anxiety or sadness or loss or loneliness. This service exists for you. As Mayor Shivi mentioned, it's private. You can pick up your phone, you can download the app, and there's someone there that's going to be able to talk with you, to help you. And again, it doesn't mean that you have a problem. It doesn't mean you have to fix something. We can all just benefit from having someone who's there to listen to us, who's there to hear our story. And sometimes, especially over the course of the past few months, it can be a really isolating experience. We could really feel disconnected. And so I know myself as a therapist on the platform that oftentimes it's about just knowing that there's somebody on the other end of that phone, knowing that you could, you know, reach out and you could talk with someone and tell them about your day and you're going to get a response. So I'm so incredibly grateful, in speaking on behalf of Talkspace, so incredibly excited about this partnership and to truly extend our mission to the city of Reno and to be able to offer this service to individuals who may be struggling with multiple forms of stress and anxiety and fear and depression and loneliness. To be able to know that they have this available to them, I think is a really powerful thing for sure.
Well, that's good stuff. Madam Mayor, Dr. O'Neill, any other comments before we open it up to the floor for media?
I would just say, John, I want to really make sure, because I know the first code that we rolled out was for our first responders, I believe. So it was sort of a soft rollout. So I want to make sure that we are able to get out how to access this service in our community. I have to tell you this, I am really impressed with sort of this younger generation being so comfortable with sort of this app. I think, you know, my generation, we probably would prefer to seek services in person, but I'm learning that that's not the case, certainly with our younger demographic. And it's pretty remarkable of how many sort of teenagers have reached out and said this is their sort of most comfortable form of a platform, which is really interesting to show how we're sort of changing in technology and everything is sort of changing, how this pandemic has really kind of ramped us up on that level. But I want to make sure that everyone knows how to access Talkspace and how to get on the network. I think that's really critical. I also want to say with my experience, I was impressed because they paired me with someone that was specialized in complicated grief. And that kind of tells me that they're asking all the right questions and getting you in touch with what your needs are. Some people might need just therapy on a small interim basis, and some people might need it a little bit more long-term. It's sort of different for everyone. And there's a way to be able to identify that with this app, which I think was pretty remarkable. And then I have to say, some of our public safety has reached out to me and said, hey, I was never comfortable actually being seen going into a therapist's office. And I wanted to have sort of that anonymity whenever it came to having that option, that this makes me feel comfortable and that I can be more private in this type of environment with an app. So I think it's really fascinating to see how it is changing, how we are interacting and how we face challenges in the future, how technology has kind of brought us into a whole entirely different space. So I just want to make sure, Jonathan, is the best way to send everyone to hopefulcities.org.
I think the contact info is in the RSVP
Okay.
or press release that we have, because there's both Hopeful Cities and also our sign up page in there too. So you have both of those options for sure, because there's different ways to access this healthcare and options as well, and just even to get the conversation going. And speaking of that conversation, we'll start going with Channel 2. Cynthia, or any of the reporters from KTVN.
Okay. Hi, Cynthia.
All right, we'll move on. We've got Channel 4, Kinsey, or anyone from the station.
I'm here. Can you hear me okay?
We can
Hi.
indeed. Go ahead.
All right. Hi, guys. Thanks for doing this. I appreciate it. I know you mentioned it's been kind of a soft rollout thus far. There was some coverage when council approved it. Do you have a rough estimate of how many people are utilizing this service already?
I believe it might be close to 2,000, I think, just in the soft rollout.
I believe we just got
Okay.
close to I believe we just got close to 1,000, and that was soft launch just for city employees and the police department.
And then one more question, Mayor Shiva, you mentioned that you've been utilizing the service. Can you talk about your experience and what that's been like?
I was pleasantly surprised. I have to tell you, I was a little skeptical at first. Again, I think that, our generation wasn't born with our phones in our hands, but some were. This new generation certainly is so much better at it. So I was skeptical and I thought, is this something that I can embrace or something that even works? And I was pleasantly surprised, and it was very, very helpful. It was, during a time when I was dealing with a lot of grief, and I have to tell you, it was really, really impressive. And I knew that if it helped me, it could help so many other people, and that I needed to be comfortable enough to sort of share my story, as hard as it is, because unfortunately, mental health still has a massive stigma behind it. And I also hope this is a big piece of the puzzle as a community, as a city, that we can say, hey, it's not stigmatized anymore. We can face this together. We can all do this together. Again, we all worry about our physical health so much. Let's start also worrying about our behavioral health and make sure we're not leaving that behind, because I think it is just as important. We're seeing suicide higher than ever. And it just tells me that services like this in cities are so needed.
Thank you, guys.
You bet. We'll go with Sean from the Indy.
Hi, thanks for having me today. I just wanted to ask, can you take us a little bit more through the process of the sign up and sort of the services offered? Like, does somebody specifically have to enter a Reno address to get the service, and how much would be covered for free through Talkspace?
All right,
I can
Dr.
Yep, I can speak to that. It's essentially a two-step process. So a user could go to www.talkspace.com/Reno, or simply just type in Talkspace in Reno into a search and it'll pop up for you. You would complete an access page that is simply just your name and your email address. And then within 1 to 2 business days, you'd be sent a unique link to be able to register for the service. So that's the process of registration. In terms of the service provided, as Mayor Shivi mentioned, we work really hard to match intentionally with a provider who is going to be able to identify your concern. So when you join the process, you're able to kind of identify maybe it's anxiety or stress or perhaps grief that you're working through. And then we're going to work to match you with a therapist who has that as an area of expertise.
Great, thank you.
Yeah, good stuff. We'll go with Kristen now from RGJ.
Hi, just a follow-up on the previous question. How many free therapy sessions do residents have access to?
Good question. And I believe it's their subscription, their regular subscription, right,
Yes.
Dr. O'Neill?
That's accurate. It's just a regular subscription for the duration of our relationship with the City of Reno. The individual has access for the duration.
Okay, so there's
Which
no
is
limit as to
here.
how many sessions people can have?
Correct. There's no limit on it's not a session-based model. It's a subscription-based model for the duration of the relationship with the City of Reno.
Which is a year. So I want to make sure everyone knows.
Yes.
And
Okay,
my
great.
hope
Thank
is
you.
after the year that everyone feels comfortable with seeking therapy.
Good stuff. We'll go to Colo and Stanton, or anyone else from the station.
Hey guys, Mike is here from Colo. For Madam Mayor first, just to confirm, so this is a year-long contract, you said?
Yes.
Okay. And then also, so is it just Reno residents? So if someone from Sparks wanted to be involved, this doesn't include them, obviously.
Exactly. So reach out to Mayor Ed Lawson and tell him to get on board.
Touche. And for Dr. O'Neill, thanks for being here. Can you just speak on, I'm sure you guys are having record participation in the last year in outreach. Can you speak on how this has been from a therapist perspective the last year? I can imagine that life isn't always so easy when you're in your shoes either.
Yeah, absolutely. I've been in the profession for 20 years. This has been by far the most difficult year of my career. It is absolutely challenging in terms of the folks I was working with pre-COVID, who I've been through a lot of ups and downs with as a result. As a therapist, you're connected with your clients, right? You have this relationship. And so when you see folks struggling in ways that are unanticipated, it's hard to witness that for sure. But just the significance of presenting concerns for everyone that I've worked with, and for, I think speaking for other therapists as well, has certainly increased over the past year and continues to increase. I've worked with a number of individuals in the healthcare field as well. And, it's been absolutely difficult. It's been challenging, but there's been moments of seeing true resiliency as well. And I think as a therapist, that's the piece you always hold on to really closely, is seeing how much folks can be resilient, how much people can change, and how much people can continue to move forward even when things are really, really difficult. So that has been the bright piece in all of this, is seeing that hope and that resiliency.
Thank you guys.
Very nice. Taylor with Sagebrush, go ahead.
So the program will be available for a year. Is there a limit? Is there a capacity of the number of Reno residents that will be able to use the program?
No, we hope it's every resident. That's our hope. And Taylor, if you're up at the university, we will be rolling out initiatives there as well to really connect with students, because I think they have also been so impacted by COVID and missed out on building relationships, especially, being a lot of the new freshmen coming in, sort of experiencing that life and sort of kind of missing some of their youth. I think it's been really, really hard on them. So we're also going to make sure that we are doing a lot of outreach on the campus.
Good stuff. All right, we'll cycle back at the top. Channel 2, anything?
Looks like we're good, I think.
Looks like so. Anyone else have anything? Kinsey, Sean, Kristen, or Mike?
I'm good, thank you.
Thanks, you guys. I really
All right.
appreciate your help in getting this out to the community. It really makes a difference. And I just believe if we can save one person from anxiety, depression, or suicide, that we're winning. So thank you so much. I really appreciate it. And
Awesome.
Dr. O'Neill, it's wonderful to see you again. And thank you so much from all of us here at the City of Reno. Please tell everyone at Talkspace we're grateful.
Thank you so much, Madam Mayor. Absolutely. You're our favorite mayor right now.
No, you're too
and
too
always
sweet.
will be.
You're too sweet. You're too sweet.
All right, guys. And remember, it's Talkspace.com/Reno, and Reno residents can go there, get signed up, and get ready to roll right now as we speak. So thanks so much, everybody.
All right. Stay safe out there, you guys. Drive safe.
You guys too. Thank you.